I've wrote an article about this distinction. A lot of people, especially a lot of men, confuse self-development and self-improvement with self-care and self-soothing. They feel like, especially during this coronavirus, that I have to be doing something. I have to maybe learn a language or improve this or improve that. And they somehow confuse that self-improvement is not necessarily self-care.
Right.
Learning could be self-care, but it could also be invariably very stressful and completely would go against what we're trying to do here. So first and foremost, I try to highlight those are two different things. You being ambitious at work is very different than self-care.
Right. Welcome to Self-Care for Men. I am pleased to welcome Dr. Lukin, who is a clinical psychologist, as my guest today. He is the director and co-founder of Lukin Centers of Psychotherapy with 6 locations throughout northern New Jersey. He also specializes in men's issues. And in fact, he was telling me that 75% of his caseload is men. The way that I got introduced to Dr. Lukin is I read his article in Psychology Today, and it was titled 5 Self-Care Ideas for Modern Men. And I thought he would be the perfect guest to have on to discuss self-care for men. So welcome, Dr. Lukin.
Sure. Thank you so much for having me.
How did you become a specialist in men's issues, or how did that evolve, kind of naturally evolve, or did you go into your practice thinking I'm going to specialize in men's issues?
Sure. I mean, during your doctoral career, typically you have experiences with all sorts of different ranges and genders, including child, adolescent, adult, and couple. So honestly, I really didn't have a plan to specialize in men's issues. I really, during my doctoral career, wanted to get as much experience as possible before even starting a private practice. So I had a variety of different experiences, including private practice, including hospitalizations, inpatient, outpatient practice. So I had a variety of different experiences, including private practice, including hospitalizations, inpatient, outpatient. So I kind of started out being a generalist, as a lot of people do in our field. And then honestly, as you may be aware of, there is a paucity of doctoral level clinicians that are male. I believe over 75% of graduates are female. So, and some of the male counterparts typically go into either industrial organizational psychology, become researchers or professors. A very few percentage actually kind of venture out into the private practice world. So having said that, for the client side, it's really difficult at times to find a male doctoral level clinician who specializes in something as specific as men's issues. So what has happened really is people started to seek me out for specific issues like anxiety, depression, relationship issues, but most of them were men. And typically the research out there suggests kind of 2 basic things or 2 general things. 1, that men typically don't reach out for psychotherapy. And 2, typically, if they do reach out, they prefer female clinicians.
Oh, I didn't know that.
And I really haven't found that to be true. If anything, my experience spoke to the complete opposite of that, be it because of the location that I'm at, be it maybe the times are changing. Not really sure exactly how to explain it, potentially a little bit of both, but I have found myself being sought after by male clients, anywhere from adolescent all the way up to, I think the most senior person I have is about 76 years old or so. So, and that's really how it started out. I noticed, obviously, since I'm male, it's easier for me to relate. I bring my cognitive behavioral expertise to bear at some of the concerns that they might be having, as it be it anxiety, depression, or relationship issues. And kind of the word got out that I work with a lot of men. And right now, as you mentioned earlier, I would say 75 to 80% of my caseload is all men. I see about 40 people, so that makes it about 30 men a week.
That's great. Yeah, as you said, a lot of men sometimes have difficulty reaching out for help. So to have somewhere to go like yourself is huge. And I agree with you. I'm a yoga practitioner, yoga teacher, besides being a physical therapist. And I noticed when I would go to yoga classes that I would be the only man in the class.
Right.
So what I decided to do is I decided to teach a men's yoga class, and
Huh.
like it, they felt more comfortable. I had a full class. The men stuck with me, for years, and they absolutely loved it. So it's nice to see men finally sort of stepping out of their comfort zone and seeking help.
Agreed very much. And just to kind of speak a little bit more about the practice, we now have about 10 clinicians, and 6 of them are men.
That's great.
So that really kind of hopefully fosters the reputation in our area that men are welcome and men are encouraged to seek help when they need to. As you probably know, substance abuse is higher in men. A lot of the anxiety and depression are being covered by other unproductive behaviors. So therefore, oftentimes people don't come in with saying stuff like I'm depressed or anxious, although that's more common than ever. Really, a lot of men come through kind of like an externalizing issue, like anger issue outbursts, potentially maybe some legal issues, drinking and driving, drugs, pornography, things like that. And then once we kind of begin to peel the onion, we begin to see that those are just some of the ways that some of the men are covering up some of the feelings that they're having, that maybe they were indoctrinated into believing they shouldn't express, or just finding unproductive ways how to cope.
Yeah, that was my next question. Why is it that men have a difficult time reaching out for help? Is it socialization, the way we've been raised in our society, in our families?
I think a big chunk of it is, especially somebody like your age and my age, where that's really been the situation. Men are not taught to express emotions, and as you could probably know, even from movies on, men are taught to kind of suck it up and just kind of bulldoze their way through their feelings into their behavior. Right. A big part of therapy, at least a big part of cognitive behavioral therapy, is sort of try to bring to the surface and honor really 3 different parts of who we are: the physical body, and something that you probably know very, very much about. Also the emotional piece and the cognitive piece. They all play a role. And just CBT, cognitive behavioral therapy, has a particular way of thinking about people, but it is really just bringing all of those things to the surface so that we can honor all of them and express them in an effective way, be it how we do self-care toward ourselves or how we effectively communicate to others, like our significant other.
Do you do couples work too? So if you're working with a man, you would bring in a partner, wife, whoever it may be?
Absolutely. I I specialize in a particular type of treatment. It's called emotionally focused therapy, which is, I think, very apropos, given that a lot of men are not very good at that. And emotionally focused therapy is exactly how that sounds. I always say it's acknowledgement and validation on steroids. So all we do is we talk about how you feel, we talk about the emotional needs, we talk about how the partner could be meeting them in effective strategies and in effective ways. So this idea of bringing forth that other part of ourselves to our partner, at least during couples work, is of paramount importance. And paradoxically, one would think, to me, I've noticed there's a lot of strength when you can own how you feel and effectively organize it in your mind and effectively communicate it. It empowers an individual.
Well, yeah, I agree. If we've been taught that being vulnerable, showing emotions, crying is a sign of weakness, and then you learn that actually it's a sign of strength, that could be empowering.
Exactly. And what I've really noticed is that there's like kind of 2 pieces to it. It's feeling the emotion, but also organizing the experience. Because when emotion is powerful and raw and sort of unregulated, it potentially does cause issues. For instance, people who can't regulate how they feel are more likely to be impulsive, are more likely to have drug issues, alcohol issues, cutting, food issues, infidelity. So the idea is that we identify how we feel and we come up with strategies how to organize those experiences and how we regulate those experiences. And ultimately, if it's couples, then how do we communicate it?
Yeah.
So that organization, a lot of the men I work with really like. because they identify so much with their mind anyway. And if we could use some of the elements or some of the strengths in that part of themselves, and we could apply those strengths to this other experience, it's very empowering.
Mm.
Not only does it help with acknowledge the feelings, but also help to organize and express. And people, as I said, men, especially who identify with their cerebral parts of themselves, really like that approach.
Mm. So I could see how this topic of self-care would be also so important for men. And you wrote an article about it. So let's talk a little bit more about that. How would you define self-care? In your article, you said it's not just doing something, but it's also a mindset. What did you mean by that?
Yeah, I think maybe the one thing I want to highlight is what it isn't. And one thing I actually, funny enough that we started to talk about, is that I've wrote an article about this distinction. A lot of people, especially a lot of men, confuse self-development and self-improvement with self-care and self-soothing. They feel like, especially during this coronavirus, that I have to be doing something. I have to maybe learn a language or improve this or improve that. And they somehow confuse that self-improvement is not necessarily self-care.
Right.
Learning could be self-care, but it could also be invariably very stressful and completely would go against what we're trying to do here. So first and foremost, I try to highlight those are two different things. You being ambitious at work is very different than self-care.
Right.
So that's one thing to kind of talk about what it isn't. Generally, self-care, I mean, to me, it's a very simple way to define it, is like, when you're using that strategy, are you soothing the nervous system? I mean, let's not remember, I saw a meme on Facebook that has a picture of the nervous system, including the brain, and then it says, that's you with an organic spacesuit around it.
Right.
And I thought that was very clever, because it's from as a psychologist, that is exactly what's happening. We have a nervous system. It gets taxed and overwhelmed for a variety of different reasons. It's our job to self-soothe that nervous system. And whichever function or whichever way that individual is able to do that, that's effective and productive, I would consider a self-soothing, self-care technique.
So that would be different for different people?
That would be completely different for different people, because the element isn't what you're doing. Let me phrase, the most important part isn't what you're doing specifically, it's the end goal. If the end goal is self-soothing, self-regulation, then whatever tool you find is a good one. I like something super basic, and potentially you could actually speak more to that, is stimulating the 5 physical senses.
Yeah.
Yoga, there's been some studies, as also you may be aware, to show that especially for trauma and feeling overwhelmed, yoga has shown to be especially helpful.
Right.
Because it focuses on attention, maintaining attention, which by definition starts to kind of soothe and improve the person's emotional functioning. So, any effective stimulation of the 5 senses is a really great way to go. That does not mean you do your cliche bubble bath with candlelight, as most people would imagine. It is, however, noticing that five senses and the stimulation of the 5 senses in an effective way is soothing to the nervous system. And that's ultimately what we want. If you take a look at any addiction, it's exactly what's happening. The person is trying to soothe their nervous system, it's just doing it unproductively and ineffectively.
Right. I would say, because I'm a little more holistic oriented, sugar would be another addictive substance that people use. Caffeine is another.
Sure. I mean, obviously, caffeine is a stimulant, right? Sugar has been linked to inflammation. So there's definitely elements. So if your body is inflamed, it's stressed. It's stressed, you're more likely to perceive stress, right? Caffeine is a stimulant, right? Like if you're sensitive to that or drink a lot of it, you're probably going to be hyped up. So yeah, I would absolutely agree with it. Obviously, I'm a clinician or somebody who focuses primarily on emotions.
Right.
I could kind of give feedback from that point of view, but any improvement in an overall physical health will significantly improve your mental health and your emotional health. And although when I was younger, I was thinking going whether the medical route or the psychological route, the more and more that I'm in this field, the more I see two marrying each other really, really nicely.
Absolutely.
I mean, there's a movement to have mental health professionals as a part of primary care.
Right.
There's a push in the future. For instance, when you go for your wellness visit, for example, you would have maybe 20, 30 minutes with your MD, and you have 20, 30 minutes with a mental health specialist, right? Just to kind of bring it holistically into integrated, it's called integrated primary care, just to bring those two worlds more and more together.
In your article, you talk about making time for yourself, which you've discussed already, engaging with others, and men in friendship. That's a whole nother discussion we could have, because you also wrote an article about that.
Right.
Maybe at some time we can have another interview and talk about that. And also, you wrote an article about raising healthy boys. I think that would be another great topic. Embracing health, physical and mental, and under that I would put the yoga, exercise, nutrition.
Absolutely.
Find passion. So something that makes you feel good. That's
it's three big pillars that I think about for healthy self-esteem, especially as it comes to my work with men, is highlighting three elements, three pillars, if you will. You want to have self-mastery, meaning literally you're good at something and you feel good about that. You allow yourself to have joyful activities in your life, and you have effective, fulfilling relationships. So those are typically individuals who have fulfilling lives, and those three big elements to their experience typically do better. So I always give an example of the quintessential prototypical, if you will, golfing with your friends during, let's say, during a business meeting or something like that. It may seem like business as usual, but if you look at it from a clinical point of view, there's actually those three things that are present. Self-mastery, if you're conducting some business, you're enjoying yourself and you're connecting with other men, right? Like, so if you really put it together from a clinical point of view, that experience in itself typically is very fulfilling, because you're actually hitting the three most important parts to good self-concept.
Awesome. And then lastly was the knowing the signs of burnout. What are the signs of burnout?
The signs of burnout, again, for men, typically they fall within at least the men that I see here, substance abuse. Substance abuse typically is the doorway to how I know an individual is likely burnt out. I would probably say any externalizing behavior, be it, some men attend strip clubs, other men develop, in this area at least, a cocaine issue, infidelity, right? So those typically signs of I'm overwhelmed, I don't know how to cope, and I need to pull something in that's a much more powerful, intense experience in the moment, such as the ones that I've just mentioned. So typically I see a lot of that.
Right. So, and also probably anger management, violence, things like that.
Anger management as well as too. The individuals that I typically see, because they hold, sometimes higher positions at corporate America, they really not allowed to develop like an anger issue, because they will be kind of let go very quickly. But I've noticed that a lot at a particular level, alcohol abuse is I don't want to say allowed or encouraged, but I'm going to say look the other way.
More acceptable.
And even if it's like inebriation at work, or not completing tasks, as long as the individual overall functions at work, that is dismissed, overlooked. So therefore, that problem typically gets bigger and bigger and bigger.
If someone wanted to reach out to you to ask you more questions, I'm sure during this whole pandemic that we went through that you were doing a lot more therapy, either by phone or by Zoom. So you could potentially see people from all over the country. So if someone
Absolutely.
if they wanted to get in touch with you, how could they do so?
I think the best and the easiest way to learn a little bit more about our practice is to go on our website, and that's lukincenter.com, Lukin center.com, and you learn a lot about our clinicians, including obviously about myself, about the locations that we have, and my number, which is also on the website, but I'll give it here, 917-903-1901. And it is my direct number, so there's no office manager that you have to go through. You get directly me, and we'll talk through what's going on for you. And if I'm the best fit, then I'm more than happy to work with you. And if somebody else is the best fit, I'll kind of make some suggestions as appropriate.
Mm-hmm. And I'll post a link to your website on my
Excellent.
social
Thank
media
you.
platforms. Well,
Thank you.
Again, Dr. Lukin, I appreciate your time today, and very informative, very important for men to seek help when they need it, and to take care of themselves. And
Yeah.
hopefully we can have another discussion at another time.
Agreed very much. Yeah, let's plan for another one when time becomes available. And it was a pleasure being on.
Absolutely. Thank you. Appreciate it.
Thank you. Bye-bye.
Bye now.